Welcome back to Healthwise. With us is my special guest, Dr. Paul Miller. Dr. Miller, we were talking about that board you're on and what could be done, and let's finish on what you were saying,
Thank you, Reg. The obstacles, what can be done?
Mm-hmm.
We're trying to manage a program or suggest the legislature and to the Secretary of Health and the governor to be able to improve upon a program that's set up to help people in need, financial need, that need medications. But when you look at it, federal guidelines state that the young, the children, pediatric population, and the old, those living in the older population living in chronic facilities,
mm-hmm.
nursing homes, there's no limit to their medications.
Right.
But managing that, we've seen not necessarily the children, but the older population, their medication list gets out of hand. 25 or more medications on many of these people. And so that's a large expense burden. It's not just an expense, and we don't want to take away money from the pharmacies. The pharmacies, it costs to prescribe. It costs to prescribe. But can we make it more efficient? Can we do every 3 months? Can we look at ways to be efficient? Can we restrict the formulary more and do the open bid process rather than waiting on rebates? See, if I can't see the actual total cost per similar agent, then I have a hard time being convinced that it is dollar for dollar a savings. Mm-hmm. I'd like to see that cost savings. I'd like to see the public more involved through the committee's website so they can communicate more with the committee members and give suggestions. Many people are very bright out there, a lot of wisdom to help suggest things. And I'd like to be able to see a stricter, time-proven, evidence-proving formulary that does not allow every drug to come on the market at 6 months. Right when it enters there for a 6-month minimum. That may have had its purpose when HIV and the new medications came out to combat those agents, and that may have had its purpose. There are emergency proceedings that can override if you need that for some terrible condition. Maybe a new immunization needs to come out.
Sure.
But right now we don't have a need that I see to do that. What are the obstacles? Well, there can be a lot of obstacles for changing the patterns. When people feel and they may be doing a great job for a long time, anytime there's change in that pattern, people get upset and say, oh, you can't improve it, we tweaked it, and maybe not. But I'm the kind of person that likes to look at things and look at root cause analysis strategies and say, let's take some suggestions and let's see where we can look at the gaps here. We know there are gaps. Patients, depending on their level of ability, should have some skin in the game, should have to pay a significant copay if they are over their limit of medications and there's overrides done. There are certain medications, like over-the-counter medications, some of them we shouldn't, in my opinion, be paying for. Because you think about it, some of the over-the-counter medications like non-steroidal anti-inflammatory, there are very few instances of chronic use of that. That agent is one of the #1 causes of kidney failure that I see that can be prevented.
And we use that's being, like you said, overused.
Overused. So we have to look at things and where we can save and where we can help improve safety of the delivery of medications. So if the tax money is being paid to pay for over-the-counter medications that can harm a patient, we have to really look at that. Getting people in their skin in the game. When you have to pay a copay, you will think twice about abusing or not taking the medication. Sure. Being empowered to be part of your health, and you take much more importance in your independence of health if you're responsible for something. Looking at the cause and analysis, looking at the cause and effect, saying clinical connection to the medications. We may have patients on a lot of medications. Are we seeing a clinical benefit? The statutes require reporting of the clinical benefit of the medication use to the committee, to the legislature every year. We want to see good trending analysis. We also want to see responsibility by the patients. It's a patient's responsibility not to waste medications. We want to see improvement. I'd like to see improvement with reducing the burden of costs where we can, whether it be administrative, whether it be, unfortunately, it may hurt some pharmacists and the obstacles. There are some pharmacists that will not want because it will hurt their bottom line. We all need to help kick in here to improve the program so that more people can benefit from it and benefit wisely from it.
Okay. Well, thanks, Doc. And once again, welcome to Healthwise. Hopefully this is not the last time. You've been a guest many times, and thanks for being with us.
Thank you, Reg.
And we'll see you next week on Healthwise.
Healthwise is brought to you in part by Opelousas General Health System.